There's no respite for Southeast Asian nations. With healthcare systems already under strain due to the coronavirus pandemic, countries like Singapore, Malaysia and Thailand are also grappling with another infectious disease outbreak, dengue fever. We are seeing exploding numbers of dengue in Southeast Asia, Dr. Leong Ho Nam, a Singapore-based infectious diseases physician at Mount Elizabeth Novena Hospital, told CNBC in an email. Dengue fever is spread by mosquitoes and can cause fever, muscle and joint pain, severe headaches and even death in its most severe form. Singapore's National Environment Agency (NEA) said last week that the island nation is set to surpass its previous annual record number of 170 dengue fever cases in 2013. As of July 6, more than 500 dengue cases have been reported in Singapore, according to the NEA. There is no doubt that it is going to be a bad year, said Leong, commenting on the situation in Singapore even before the NEA announcement. Elsewhere in the region, Malaysia's Health Director General warned last month of a spike in dengue cases across the country, local media reported. In Indonesia, Southeast Asia's most populous country, local health officials said in late June there were 68,000 cases of dengue fever countrywide. According to the U.S. Centers for Disease Control and Prevention, the dengue fever risk in most Southeast Asian countries, with the exception of Singapore, is classified as frequent, continuous. The spike comes at a time when the world is battling the coronavirus pandemic that has left global economies battered and millions sheltered at home as a result of social distancing measures aimed at curbing the disease. Unfortunately, dengue met the best marriage partner, lockdown, Leong said. With individuals staying at home because of COVID, more are exposed to the dengue mosquitoes breeding in the neighborhood. The more cases there are, the more likely uninfected mosquitoes will bite the infected individual, causing a spiraling of cases upwards, he said. Dr. Dwayne Gubler, founding director of the Emerging Infectious Diseases Signature Research Program at Duke NUS Medical School in Singapore, agreed. People who are stuck at home all the time probably have greater contact with mosquitoes that are infected with dengue, Gubler said, warning that greater precautions needed to be taken to control mosquito larvae. Furthermore, Gubler also flagged the danger of construction areas and said they were a major breeding site for mosquitoes as a result of coronavirus lockdowns. The COVID epidemic could very well be influencing dengue transmission, he said. Among the Southeast Asian nations, Indonesia currently has the highest number of coronavirus cases at 736, according to data compiled by Johns Hopkins University. That's followed by the Philippines, which has 754 cases and 423 reported infections in Singapore.